The broadcast is now starting. All attendees are in listen-only mode.
Good morning and welcome to today's webinar, Arbitrary Mounting. My name is Sarah Brown and I will be facilitating today. Before we get started, I want to go over a few housekeeping items. As many of you already know, this course is NBC approved for 1 credit. Within about 24 to 48 hours after the webinar, you will be sent information on how to obtain the credit. And we are recording today's webinar. So if for whatever reason you have to leave early or would like to have others from your office or lab watch the webinar, they can do so by going to our website, whitmix.com, but allow about 72 hours for it to be posted. In addition, if you have any questions that you would like to ask throughout the webinar, please use the question box located on the right-hand side of your screen. We will be answering all questions at the end of the webinar. Now I'd like to go ahead and introduce Craig Pickett. Craig is NBC certified in Crown and Bridge with a technologist designation. With over 25 years experience in the dental laboratory field, Craig has owned his own Crown and Bridge ceramic and implant lab and has worked as a technical sales representative for 3 major laboratory manufacturers. Craig currently works at Whitmix Corporation as our technical support manager. Craig?
Good morning, everyone, and thanks for attending this morning. This is kind of an interesting little topic. It's something that we do every day without really thinking about it in the model and die department. And there are some related issues that could be showing up in your final cases that go off to the doctor. So we want to talk a little bit about arbitrary mounting and how it relates to our daily activities and perhaps how we could use some better management of those mountings so that we have better final products in our patients. So if you will, with me, we're going to walk through arbitrary mounting. Let's see. Here we go. Let's get back. We kind of pushed a little too many buttons too fast. And we'll get back to the beginning. All right. Now, sorry about that. In previous webinars, we've indicated there are advantages to using full frame articulators over disposable and small frame style articulators. We have on our website some previous webinars to that degree that you can go in and take a look at those if you'd like and improve your knowledge and understanding of full frame articulators and their use. But some of you might remember some of our discussion when we talked about arc of closure and also the radius for lateral excursion. If you look on the left-hand side of your screen there, you see a picture with some circles. These represent different types of articulators, the yellow line and circle being that of a full frame articulator, the green of a articulator which would be similar to, say, a Foster Apex 2 brass articulator that are very common, and then the orange being a disposable articulator. Now, you'll notice that the circles that are generated there, these are the arc of closure. And you can see that the anterior envelope of function changes with those different articulators. That means that as we put things together on an articulator, they're not actually functioning the same as the patient. And that is our ultimate goal. When it comes to radius for lateral excursion, you can see just in the drawing here that there is a change in the way that things move when you shorten that radius. Here we are on a, this would represent, here we go, this would represent a large frame style articulator, full size articulator, and if this is the position of the tooth versus their, in relationship to the condyle, that radius would move similar to this down here. Now when we take and we shorten it up with a small articulator like is normal in the lab, then that radius becomes quite a bit shorter. What that means is that the movement of the teeth as we go across the cusp is going to change. And that means that how you reproduce that crown is going to be different than how it functions and moves inside the patient. And so it's much better to work with a large frame articulator. Now, every patient's measurements are different. We know that. Every face is a little bit different. You can see two examples here of two different types of patients in different classes. And how do we go about capturing all of that information? How are we to know, as dental technicians, what to produce based on what patients are like? Ideally, we're going to capture that information with a Facebow registration at the office. This is the preferred method right now for transfer of the patient information to the articulator. We use what is called the Frankfurt plane, which is a horizontal plane here that's captured by this upper member of the articulator, or of the Facebow, excuse me. And we capture the inclination of the occlusal plane on each patient specifically for that patient by using that bite port registration. Then we take and we transfer that information to the articulator. There are two types of transfer. One is called indirect, where we do not use the bow itself, and the other is called direct, which is like this. And different articulators use different systems. Some, like, for example, the DENAR line of articulators do not use direct transfer. They use an indirect system, and so you have to be set up for that. We get a lot of questions about which articulator should we use, and it kind of comes back to a large frame articulator that is capable of accepting the Facebow registrations that your doctors are using. We, of course, prefer that you indicate that they use a Whitmix, a Hanau, or a DENAR articulation system. We think they're the best in the world. Now, the Facebow, with the bite fork registration, places that maxillary cast in the duplicated anatomical position of the patient within the frame of the articulator. Now, that's pretty critical when we're talking about function and reproducing a prosthetic device that's going to function the way that it should inside the patient. But it's an unfortunate thing that most of the time we get this, a prescription that simply says mount to large articulator. I think I've said in the past that in the 12 years that I owned and operated my laboratory, I had maybe 3 or 4 Facebows that walked in the door, which is pretty sad, actually. And most of the time it simply came in saying mount to large articulator. Well, that's not a lot of information. Now, there's an advantage. We've talked about some of the advantages, especially in terms of the anterior envelope of function when we mount to a large frame articulator, and that's a good thing, but we still don't have a lot of information. And so what do? How do you deal with that situation? Well, there are some current methods of achieving placement in the articulator, and let's talk about those if we can just for a minute. The first one is guessing. This is probably the preferred method out there in the laboratory. We take and place some kind of a bite registration, either by using the registrations given to us by the doctors, or we do what is often referred to as handulating, which is simply hand articulating the cast and relating the cast. And then we sticky wax them together, or we glue them together. We blob of mounting stone or plaster onto the articulator, and then we sort of hold it in place, and we guess that that's the appropriate position within the articulator frame. This is done more and more and more, and then if we succeed with not too many negative responses from the doctor, then we feel that we've done an excellent job. And we continue to do it approximately the same way to the point where we feel like we're successful in what we're doing. The reality is that we're only marginally successful at what we're doing when we're guessing. The second is the use of modeling clay. Those of you in the United States Air Force often call this casein, but just a clay of some kind as a support mechanism so that we can locate the casts in the frame of the articulator without worrying about plaster or mounting stone setting in the process. It gives us a chance to look at things and move things around and before we actually lock them into place. The third kind's been around for a long time. This is the rubber band method, where we simply stretch a rubber band and then we try and locate the casts within that triangle of the rubber band, which is not a bad idea. It gets us relatively close to what we're doing. But there are, with all of these systems, related problems. And let's talk, if we can, just for a moment about some of the problems that come along with those systems. The first question we're always asked is, what position do I place my casts in the articulator? Now you'll notice, do we put them right over the mounting plate? We actually have phone calls where folks call and say, this just isn't right, it's not centered over the mounting plate. And is that correct, to have it centered over the mounting plate? Or do we place them anterior to the plate? You'll notice here that we have just a little bit of difference in the position of that anterior tooth relative to the mounting plate in each of these two photographs. So which one is better? Well, remember, we've been talking about arc of closure. So as we push this model further back into the articulator, it changes the arc of closure. And therefore, the anterior envelope of function changes. So even though it's on a large articulator, we've just changed how those models are going to function, and therefore how the restoration we manufacture is going to function when it gets back to the patient. So this is a problem. Now, the other question is, am I centered correctly in the articulator? A couple of things we need to look at. First of all, how am I doing left-right here? Well, this photograph might be a little off, but if we use the anterior pin here as a guide, it's looking like maybe we didn't quite get that centered, that model centered correctly. And then what about the either the down or the up, how it's rotated inside there? If you rely on how you trim the bottom of your model off, this is looking like it's not quite right. But then we know that we don't always trim the bottom, right? So how is our plane of occlusion doing here? And it looks to me like in this particular mounting, it's a little bit canted downhill, and that can create problems later on if we do that. Now, how is my position left to right and relative to the condyles that we've got? We drew a couple of lines here, the first here going right through the median line. Now, if you look here, we're a little bit off, aren't we, on this particular mounting? Didn't quite get centered up like we should. And then how am I in terms of my teeth relative to those condyle points? And you'll notice that this is swung or kicked out a little bit to the left-hand side of your screen. That means that when this articulator functions, the models are actually off, and our restoration, therefore, is going to be off. Our cuss tips are not going to function the way that they do when it goes back to the patient. And so this is a negative on our part, even though we mounted it on a large articulator. We didn't get the information necessary to mount this thing properly, nor did we, in our arbitrary mounting, produce something that is going to functionally work correctly. All right, so how about the elevation here? We've seen before, and I'm sure you have too, where there's huge columns of plaster or stone either on the bottom or the tops of articulators. And so where do we place this elevation of the occlusal plane relative to the condyle? That becomes an important matter. And then also, what is the angle of that plane of occlusion? Are we being really flat? Are we being 10 degrees? Are we being, how are we in that mounting? Are we relying on mounting it horizontal to the table? Or do we have give it a little bit of a kick up here in the posterior? You know, it's just how you were taught, right? But it's still way too arbitrary. We just have too many pieces of information that may or may not apply to what we're actually doing here. And so how do we come to a basis for doing things correctly and at least getting as much correct information as possible every time? Well, you can reduce some of these problems if you establish position in the articulator using the averages of the Bonwill triangle. Now, we talked about Bonwill before and his theories, and so let's just touch on it once again. Bonwill is an equilateral triangle with 4-inch or about 110 millimeter sides bounded by lines from the contact points of the lower central incisors. You can see that right here, okay? Contact points to the also, if you don't have contact points, you're going to be at the median line of the residual ridge there. So there's a little variation in there. But from that to the condyle, and then from condyle to condyle. Now, this average of 110 millimeters is generally what most large frame articulators are built on. This 110 intercondylar space. So we're going to duplicate this Bonwill within the, as we set up our models within the full frame articulator so that we can be in a natural average of patients that are out there. Okay, now achieving that accurate Bonwill measurement is pretty hard to do without a little bit of mechanical assistance of some kind. You can get out a ruler like this and you can try and measure, but the models get in the way and it's tough to do. You can get close, and close is better than far away, but it's not as accurate as you could. Articulator designs that are like the ones that are shown in the pictures here are already arbitrary because they can't produce any kind of geometry of the patient. We've talked about that before. They really are about open close. They got a little bit of left and right lateral movement, but even then, that arc is incorrect based on the patient. So we're only getting close with these types of articulators and with this kind of geometry. Now, most full-frame articular companies have come up with some kind of mounting stand to assist you in the proper placement, and most of that is based on Bonwill geometry and how it fits in their instrument. And so if you have large frame articulators, you should look into some kind of mounting stand for that articulator. If you're not using either a Whitmix, a DENAR, or a Hanau articulator, then I would suggest contacting your articulator company to find out if they have some kind of a mounting stand that you could use. Now, Whitmix has this year developed the DENAR Occlusal Mounting Stand. This mounting stand is for use with the DENAR articulator lines, the Hanau articulators, and the Whitmix lines, which use the Whitmix magnetic system, not the screw-in system, but the magnetics. And this is a great little articulator stand, and we're going to use this, or mounting stand, excuse me. We're going to use this particular stand as we go through this procedure on how to use one of these mounting stands. In this case, we can adjust this particular mounting stand for the articulator to be used. You'll notice over here on the sides we have some marks here. Whitmix and DENAR, either 0 degree or 10 degree, this table can be set. It comes with either a flat or a curved table, which mimics the Monson sphere. So you have some variants here that you can employ to get the best relationship for your particular case in your large frame articulator. So you're going to set this up based on how you're going to use the mounting stand. Okay. We have also with this particular one an anterior fence, which is aligned for the angle of the table. There's some little markings down here on the bottom that says flat or 10 degree. If you use a flat table, you rotate this to flat. If you use the 10 degree, you turn it around so that it's available. Now, what this is a stop point for your anterior teeth that allows it to stop at the correct position and we'll give it that 110 millimeter spot for those lower anteriors. All right, now, if you've not been given any other information, you're going to use average settings of 25 to 30 degrees condylar inclination, which is protrusive, and 15 degrees progressive side shift. And you can set your articulator up like that, or if you have a fixed articulator which has the information already plugged into it, this is where you're going to have to go anyway because you weren't given that information by the dentist. So you're just going to use average settings, even though you have a very fancy articulator. You're going right back to average settings, so just get them set there at that position. Now, you're going to mount your occlusal stand on your articulator, and then you're going to align the maxillary cast using the fence and the scribed lines to make sure that the cast is centered correctly. Now, if you do not have those scribed lines on your particular mounting table, then you're going to want to methodically put some lines there so that you can go to the same spot each and every time. On this universal occlusal stand, you can see where we have mounted this, and then we're going to pay attention to the position of the teeth on the lines. Okay, the centering between the 8 and the 9 on your anterior, and then of course your posterior on both sides should be in the same position on your table. We're going to stabilize that model and fix it in place, and you can use utility wax or you can use hot glue, whatever your departments are using, but you do want to make sure that that is stabilized so that as you go through the mounting procedure, your maxillary cast does not move around. Okay. Now you're going to use a low expansion mounting stone or plaster. A lot of technicians just use any plaster they can find in this particular procedure, and that actually can get in the way of what you're doing because that plaster is going to mount, it's going to move, it's going to expand when you mount, and it's going to push your models into different relationships. So you do want to use low expansion material. You're going to adhere the maxillary cast to the upper member mounting plate first. And then you're going to remove the excess stone. Now, this helps to control the expansion because expansion in stone is based on the volume of the stone that you've mixed. Expansions are reported as percentages of the volume. So the smaller the volume, the stone has a tendency to move linearly a smaller amount. So you want to not have a bunch of excess stone on there. And besides that, it increases the aesthetics of the mount. And then at this point, you're going to allow that stone to set and hold your maxillary cast in place. Then you're going to remove the mounting stand from the model and from the articulator and invert the articulator, okay, so that it's standing on the upper member now, and you're going to install the lower mounting plate. And then you relate the maxillary to the mandibular model using the bite registration material that the doctor sent to you, or if they did not send you a bite registration, then you're going to hand relate and secure it in place with either hot glue or sticky wax, whichever system you use in your laboratory to hold those models together. Okay. Now, if you're using higher expansion plasters, or if you need to compensate for the thickness of bite registration materials, some bite registrations are a little heavier than other bite registrations depending upon the practitioner. You may wish to open the pin slightly so that it will return back to the 0 point after you finish mounting. You'll be able to tell that on your particular articulator and the use of the individual registrations that are sent to you. Okay, apply the mounting stone to the lower model and close the lower arm of the articulator over the top of your lower model. At that point, you're going to do the same procedure again. You're going to smooth out or remove the excess mounting stone, and you're going to allow it to set up. Now, once that's been accomplished, your mounting is actually now functionally ready to use. It has been placed now in the articulator inside the Bonwill triangle. Your positions are correct relative to the condyles, and the envelope of function will now be correct as it can be based on the fact that you didn't get a lot of information from the doctor. But at least you'll be closer to the averages of the human skull and its function with the jaw, so that your restoration now will function properly when it gets back to the patient. You should have much less doctor adjustment to the crowns and the bridges that you're manufacturing. Now, for better aesthetic mountings, if you're going to be sending this out of the dental laboratory, you can take the cast now off your articulator. You can add mounting stone to the areas which were short of stone that didn't look quite nice. Let it set up just to that hardness point where you can work with it. You can use a laboratory knife at that point to scrape off any excess, and then when it's set up fairly fully, you can, with some small grit sandpaper, we use about a 320 wet dry sandpaper around here, you can sand that mounting stone down until it looks beautiful. And now your mounting is complete and is ready for presentation to the doctor or presentation to the patient. You're accurate as you possibly can be in an arbitrary world. And you're consistent, which sounds funny, but you're consistently arbitrary or arbitrarily consistent. One of those two things. But at least your cases are mounted the same way each and every time. You're not going to have that lack of consistency coming to a larger frame articulator, like you do if you're just making a guess, or if you're using the rubber band method, or if you're using the modeling clay method. All right, we have a short webinar today, but we do want to field any questions about doing that kind of arbitrary mounting that you might have. And also, we want you to understand that Whitmix is very interested in providing for you webinars that you have interest in. So if I can, I'll solicit your help to send us some ideas for things that you're interested in learning about. They can be new techniques, old techniques, whatever they happen to be. Go ahead and ship them on in to me here at Whitmix at cpickett@whitmix.com, and we'd be happy to field those and take a look and see if we can't produce something for you.
All right, before we get to our questions and answers portion of the webinar, I just kind of want to go over some of the upcoming events that we have here at Whitmix. We only have 2 webinars left for this year. We have a 2-part series on dentures and wax-ups. And then in December, we have Sustaining Your Lean Process. As well, on October 7th and 8th, we are having our annual Lean Symposium of Dental Technology here in Louisville, Kentucky. It's a great opportunity to learn about what Lean is and how it can improve your dental office. So if you have any questions about those, please call us here at Whitmix, or you can visit our website at whitmix.com for more information. It looks like we do not have any questions right now, so if you think of something later on, please email us at webinar@whitmix.com or give us a call, and we'll get those questions answered. So I'm going to go ahead and say goodbye, and thank you all for attending. Oh, wait. Craig, we do have one question that just came in. Are there mounting stands available for the model?
There are mounting stands available, yes.
For the 2240.
For the 2240. Absolutely. If you have a regular 2240 that's a screw mount, there is a mounting stand that's available for that. You may wish to consider changing that into the magnetic mount system. Now, it's hard to jump back and forth between screw and magnetic. With the Whitmix system, you really need to move over. There are 2 options there. One that's rather, not permanent, but semi-permanent with a quick mount system. And that would be the one that would be available there. That'll let you use this particular universal mounting stand And that would be my suggestion, that you go that way rather than stick with screw. It's just a lot easier to deal with magnetics. But there are mounting stands available, and like I said earlier, you really do, if you're using any large frame articulator, want to check with the company that manufactures your articulator to see if they have a mounting stand for your specific articulator.
All right, well, thank you. Just one final reminder, this course is NBC approved for 1 credit, and you'll be receiving your information in about 24 hours. And we did record the webinar, so it will be available at whitmix.com. And Craig, one more question came in. How can I find out more about the Universal Occlusal Stand?
The easiest way is simply to go to our website, which is whitmix.com. Go to, at the top of the page, go to Occlusion, and then drop on down to where it says Universal Mounting Stand, and click on that. There'll be technical information there for you. You can look up the manual is there and available so that you can step by step go through the procedures and how to adjust that stand and what it's available to use on. So that would be the easiest and quickest way.
Okay, and another question, does mounting stand used here count for the curve of speed?
It does partially. If you're set at that 10-degree mark, then you're going to get a fairly good curve of speed when you're looking at that. Now, you're not going to get a perfect one, but once again, we're being arbitrary here. If you jump over and use the curved mounting platform, that's going to more closely get you to Wilson and also a little bit of speed because it is curved. If you're using flat, you're still going to be fairly flat, but at least you can adjust to that 10-degree mark.
All right, another question here. How do I get to know about mounting with records?
Mounting with records is an interesting process, and basically if you look at the instructions for use of the articulator that you use, there will be a process there, or at least a step-by-step procedure for mounting with records. You can find those individual manuals for use for all of the Whitmix and the DENAR and the HANA articulators online. Other articulators you'd have to check with those articulator manufacturers. And that might be a very good idea for another webinar, is mounting with records. So, but for right now, I would check with the manual for use for your particular articulator.
All right, looks like we've answered all the questions today. And again, I thank everybody for their attendance and have a wonderful afternoon.